In this video, we'll study about the midbrain. The midbrain is the upper and the shortest part of the brainstem, and it is about 2.5 centimeter long and 2.5 centimeter wide. It connects the hindbrain with the forebrain, and it has a cavity, the cerebral aqueduct, the aqueduct of Sylvius, which connects the third ventricle and the fourth ventricle. The midbrain passes through the tentorial notch. This is the sagittal section. So here you can see this part is the midbrain, and this is the cerebral aqueduct which connects the third ventricle and the fourth ventricle. On each side it is related to the optic tract, the posterior cerebral artery, the parahippocampal gyrus, and the basal vein. Anteriorly it is related to the interpedunculair structures, the mammillary body, the tuber cinereum, and posteriorly it is related to the splenium of the corpus callosum, the great cerebral vein, the pineal body, and the posterior ends of the right and the left thalami. In the sagittal section, so this is the midbrain. Anteriorly it is related to the interpedunculair structure. Posteriorly it is related to the splenium of the corpus callosum, the pineal body, and then you have the posterior end of the right and the left thalami and the great cerebral vein. Next we'll see the external features. So this is the ventral surface. The ventral surface of the midbrain presents the two crura cerebri, or the crus cerebri, or the cerebral peduncle, which emerges from the cerebral hemisphere and converge downwards to enter the pons, forming the posterolateral boundary for the interpeduncular fossa. The superficial surface of the crus cerebri is finely corrugated by the underlying longitudinal fibers. It is crossed transversely from above downwards by the optic tract, then the posterior cerebral artery, then you get the superior cerebellar artery and the tinea pontis. The oculomotor nerve emerges from the groove on the medial side of the crus cerebri. The trochlear nerve emerges on the dorsal aspect of the midbrain and curls around the lateral aspect of the cerebral peduncle to appear on the ventral aspect of the midbrain, lateral to the oculomotor nerve. In this picture you can see the cerebral peduncle is crossed from above downwards by the optic tract, then the posterior cerebral artery, then the superior cerebellar artery. In between these two you get the oculomotor nerve and the trochlear nerve. Next we'll see about the dorsal surface of the midbrain. The dorsal surface presents four rounded elevations. So you have two superior colliculi and two inferior colliculi. Altogether it is known as the corpora quadrigemina. The colliculi are separated from each other by a cruciform sulcus. The vertical limb of the sulcus, when traced above, they form a surface depression which lodges the pineal body, and when traced below it becomes continuous with the frenulum vellae, a median ridge on the dorsal surface of the superior medullary velum. The trochlear nerve emerges on each side of the upper part of the frenulum vellae after decussation in the superior medullary velum. The thick ridge of white matter extending from the lateral side of each colliculi constitute the brachia. So this is the superior brachium and this is the inferior brachium. The superior brachium connects the superior colliculus with the lateral geniculate body and the optic tract, and it is made up of optic fibers. Then the inferior brachium connects the inferior colliculus with the medial geniculate body, and it is made up of auditory fibers. Now we'll see about the internal structure. The internal structure of the midbrain is studied conveniently by examining its transverse section. The transverse section of the midbrain shows a tiny canal that is known as the cerebral aqueduct. A coronal plane passing through the cerebral aqueduct divides the midbrain into two parts, a small posterior part and a large anterior part. The small posterior part is known as the tectum and it consists of 4 colliculi, and the large anterior part is divided into equal right and the left half by a vertical plane, and you have, this is the cerebral peduncle. The whole thing is the cerebral peduncle. Each cerebral peduncle is further subdivided into 3 parts from dorsal to ventral. You have the tegmentum, then the substantia nigra, then you have the crus cerebri. The structures in the tectum and the tegmentum vary at different levels of the midbrain, but those in the crus cerebri and the substantia nigra are nearly the same throughout the length of the midbrain. We will see about the crus cerebri or basis pedunguli. The crus cerebri is part of the cerebral peduncle situated anterolateral to the substantia nigra. It contains the important descending tract which connects the cerebral cortex to the anterior horn cells of the spinal cord, the cranial nerve nuclei and pontine nuclei. The corticospinal and the corticonuclear fibers occupy the middle 2/3 of the crus cerebri, and the frontopontine fibers occupy the medial 1/6 of the crus cerebri, and the temporopontine, the paritopontine and occipitopontine fibers occupy the lateral 1/6 of the crus cerebri. So the middle 2/3 is occupied by the corticospinal and the corticonuclear fibers, and the medial 1/6 by the frontopontine fibers, and the lateral 1/6 by the temporopontine, paritopontine and occipitopontine fibers. Next we'll see about the substantia nigra. The substantia nigra is a curved crescent shaped pigmented band of grey matter. It is thicker medially than laterally, situated between the tegmentum and the crus cerebri. Its concavity is directed towards the tegmentum and it is smooth. From its convex margin, you have the spiky processes project into the substance of the crus cerebri. The substantia nigra is a large motor nucleus that extends throughout the length of the midbrain. It is divided into 2 parts, a dorsal part which is known as the pars compacta containing the medium sized cells, and then the ventral part is known as the pars reticularis containing a fewer cells. The pars reticularis is intermingled with the fibers of the crus cerebri. The substantia nigra is made up of deeply pigmented nerve cells which contain melanin, a polymerized form of dopamine and iron. These cells synthesize dopamine which is carried through their axons, the nigrostriatal fibers, to the corpus striatum. When you see the clinical correlation, degeneration or destruction of the substantia nigra causes a deficiency of dopamine in the corpus striatum, leading to a clinical condition called Parkinsonism. Next, we will study the interior of the tectum and the tegmentum at 2 levels, at the level of the inferior colliculi and at the level of the superior colliculi. So this is the transverse section at the level of the inferior colliculi. So the grey and the white matter presents the following features. First we'll see about the grey matter. The grey matter Here this is the central gray matter. So this is the cerebral aqueduct. Surrounding this is the central gray matter. Here you have two nuclei. You have the nucleus of the trochlear nerve, and then you have the mesencephalic nucleus of the trigeminal nerve. The trochlear nerve nucleus situated close to the median plane, just posterior to the medial longitudinal bundle. The emerging fibers of the trochlear nerve passes laterally and posteriorly around the central gray matter and leave the midbrain just below the inferior colliculi. The fibers of the trochlear nerve, they decussate in the superior medullary velum and they wind around the lateral aspect of the midbrain to enter the lateral wall of the cavernous sinus. The mesencephalic nucleus of the trigeminal nerve lie in the lateral edge of the central gray matter. It receives the proprioceptive impulses from the muscles of mastication, teeth, ocular and facial muscles. Then you have an ovoid mass of gray matter underneath the inferior colliculus, forming the nucleus of the inferior colliculus. It receives the afferent fibers from the lateral lemniscus and gives the efferent fibers to the medial geniculate body through the inferior brachium. And the next gray matter is the substantia nigra, we have seen already. Then you have the reticular formation, which is smaller than that in the pons, and it is situated ventrolaterally between the medial lemniscus and the central gray matter. Now we'll see about the white matter at the level of the inferior colliculi. Here the important feature is the decussation of the superior cerebellar peduncle. So this occupies the central part of the tegmentum and forms the most important feature in the lower part of the midbrain. Then the lemnisci are arranged in a form of curved compact band of white fibers in the ventrolateral part of the tegmentum lateral to the decussation, the cerebellar decussation, and dorsal to the substantia nigra. From medial to lateral, these are the medial lemniscus, the trigeminal lemniscus, the spinal lemniscus, and lateral lemniscus. The lateral lemniscus is posterior to the spinal lemniscus and it ends into the inferior colliculus, the nucleus of the inferior colliculus. Then you have the medial longitudinal fasciculus or the medial longitudinal bundle, which lies on each side of the median plane ventral to the trochlear nerve nucleus. Then you have the tectospinal tract lies ventral to the medial longitudinal fasciculi. Then you have the rubrospinal tract lie ventral to the decussation of the superior cerebellar peduncle. Next we'll see the features at the level of the superior colliculi. So this is a transverse section at the level of the superior colliculi. So first we'll see about the gray matter. First we'll see about the central gray matter. The central gray matter in each half contain two nuclei. You have the oculomotor nerve nuclei and the mesencephalic nucleus of the trigeminal nerve. The oculomotor nerve nucleus lie in the ventromedial part and the nuclei of two sides, they fuse together forming a single complex having a triangular outline. The oculomotor nuclei are bounded laterally by the medial longitudinal fasciculus. The Edinger-Westphal nucleus, which supplies the sphincter pupillae and the ciliary muscle, forms a part of the oculomotor nucleus and it is located dorsal to the rostral two-thirds of the main oculomotor nucleus. The emerging fibers of the oculomotor nerve passes ventrally through the tegmentum intersecting the red nucleus and then the medial part of the substantia nigra and emerges in the posterior part of the interpedunclar fossa through the sulcus on the medial aspect of the crus cerebri. The mesencephalic nucleus occupies the same position as in the lower part. Next you can see the nucleus of the superior colliculus. The superior colliculus is a flattened mass formed by 7 concentric alternating laminae of white and grey matter. Next we'll see the connections of the superior colliculus. The superior colliculus receives afferent fibers from the contralateral retina through the lateral geniculate body through the superior brachium. So this is one afferent. The second afferent is from the spinal cord. From the spinal cord, the pain and tactile fibers through the spinotectal tract. So this is the second afferent, and the third afferent is from the frontal and occipital visual cortex through the, which is important for the conjugate eye movement. And the fourth afferent is from the inferior colliculus. So these are the afferents of the superior colliculus. Next we'll see the efferents from the superior colliculus. So the efferents are, you have the tectospinal tract, and then you have the tectobulbar tract. So these are responsible for the reflex movements of eye, head and neck in response to the visual stimuli. Unilateral lesion of the superior colliculus results in the relative neglect of the visual stimuli and inability to track the moving object in the contralateral field of vision, although the eye movements are normal. The next grey matter we'll see at the level of the superior colliculus is the pretectal nucleus. The pretectal nucleus is a small group of neurons that lie deep to the supralateral part of the superior colliculus. It receives the afferent from the lateral root of the optic tract and gives efferent to the Edinger-Westphal nucleus. The pretectal nucleus is important part of the pathway of the pupillary light reflex and consensual light reflex. Its lesion causes Argyll-Robertson pupil, in which the light reflex is lost but accommodation reflex remains intact. Next we'll see about the red nucleus. So this is the next grey matter in the tegmentum of the midbrain at the level of the superior colliculus. The red nucleus is the cigar-shaped mass of grey matter which appears ovoid in the cross section. It is about 0.5 centimeter in diameter and it is located dorso-medial to the substantia nigra. In fresh specimen, it is red or pink in color due to its high vascular supply and an iron containing pigment present in the cytoplasm of its cells. Next we'll see about the connections of the red nucleus. So this is a schematic picture to show the connections of the red nucleus. First we'll see about the afferents. The afferent fibers are the cerebello-rubral fibers. So it arises from the contralateral dentate nucleus and the fibers passes through the superior cerebellar peduncle. Next you have the cortico-rubral fibers, mostly from the ipsilateral motor cortex, the area number 4 and the 6 of the frontal cortex. It also receives afferents from the globus pallidus, forming the pallido-rubral fibers of the same side. The red nucleus also receives fibers from the subthalamic nucleus and also from the hypothalamus and also from the substantia nigra and the tectum. Next we'll see the efferents. The first efferent is the rubrospinal. Next the rubro-bulbar connecting the cranial nerve nuclei and then the rubro-reticular tract. So these fibers arises from the red nucleus. Before forming these tract, they decussate in the ventral tegmental decussation of floral, and the fibers of the rubrospinal tract ends in the anterior horn cells of the opposite side. The rubro-bulbar tract ends in the motor nuclei of 7th and 5th cranial nerve and also the nuclei of 3rd, 4th and 6th cranial nerve, and rubro-olivary fibers, and then you have the rubro-thalamic fibers and also you have the rubro-cerebellar fibers and rubro-nigral fibers. So from wherever you get the afferent, it gives the efferent fibers also. The red nucleus is considered as an integrating and relay center on the following pathway: the cortico-rubrospinal pathway, the cortico-rubronuclear pathway and the cerebello-rubrospinal pathway. Next we'll see about the white matter at the level of the superior colliculi. So first we'll see the decussation of the tectospinal, the tectobulbar tract arising from the superior colliculi, forming the dorsal tegmental decussation of Meynert. Then you have the decussation of the fibers, the rubrospinal arising from the red nucleus, forming the ventral tegmental decussation of floral. So you have a ventral tegmental decussation and dorsal tegmental decussation. Then you have the medial longitudinal fasciculus, which lies ventrolateral to the oculomotor nerve nucleus. The tegmentum at this level also contain the same lemnisci as those at the level of the inferior colliculus except the lateral lemniscus. The lateral lemniscus is not present at the level of the superior colliculus as it terminates into the nucleus of the inferior colliculus. So you can see the medial lemniscus, trigeminal lemniscus and spinal lemniscus. Then you can see the emerging fibers of the oculomotor nerve. Next we'll study about the medial longitudinal fasciculus in short. The medial longitudinal fasciculus is a heavily myelinated composite tract found in the paramedian plane of the brainstem. It retains its position relative to the central gray matter throughout the midbrain, pons and the cranial part of the medulla oblongata. The medial longitudinal fasciculus extends cranially to the interstitial nucleus of Cajal. the accessory oculomotor nucleus, which is located at the junction of the midbrain and the diencephalon near the rostral end of the cerebral aqueduct. Caudally, it becomes continuous with the anterior intersegmental fasciculus of the spinal cord. Anterior intersegmental fasciculus of the spinal cord. So this is the caudal extension and this is the cranial extension. The medial longitudinal fasciculus consists of fibers arising mainly from the vestibular nuclei. Some of the fibers also arises from the nucleus of the lateral lemniscus and also from the interstitial nucleus of the Cajal. The fibers of the medial longitudinal fasciculus interconnect the nucleus of the third, fourth, sixth and fifth and also the spinal nucleus of the accessory nerves. The chief function of the medial longitudinal fasciculus is to coordinate the movement of the eye, head and neck in response to the stimulation of the vestibulocochlear nerve. Next we'll see about the medial longitudinal fasciculus syndrome or internuclear ophthalmoplegia. It occurs due to the lesion in the upper part of the pons in the region between the abducen and oculomotor nuclei, and the medial longitudinal syndrome is mostly seen in multiple sclerosis and presents the following clinical features: isolated paralysis of the medial rectus muscle of the eyeball on the side of the lesion on an attempted lateral glaze. So in this picture you can see, so this is the normal vision, the baseline. So when you ask the patient to look to the right side, so the lateral rectus of the right and the medial rectus of the left eye acts. So the sixth nerve and the third cranial nerve acts. So when you ask the patient to look at the left, the patient is able to move the left eye to the left side, but the right eye cannot move to the left side, or the medial rectus is affected. So this is the isolated paralysis of the medial rectus muscle of the eyeball on the side of the lesion on an attempt of lateral gaze. The mononuclear horizontal nystagmus in an adducting eye contralateral to the side of the lesion. So here you have the nystagmus will be present in the contralateral side. The convergence and the vertical gaze remain unaffected. Blood supply. The midbrain is supplied by the following arteries. So it is supplied by the basilar artery through its posterior cerebral and the superior cerebellar arteries. The basilar artery also supplies the midbrain through direct branches. Then the branches from the posterior intercommunicating artery and the anterior choroidal artery also supplies the midbrain. The venous drainage by the great cerebral vein and the basal vein. So the basal vein and the great cerebral vein drains the midbrain. Next we'll see the clinical correlation. First we'll study about the Weber's syndrome. The Weber syndrome is produced by a vascular lesion in the basal region of the cerebral peduncle due to the occlusion of a branch of the posterior cerebral artery. The lesion involves the oculomotor nerve and the crus cerebri, and it produces the following signs and symptoms. First, it produces ipsilateral lateral squint due to the involvement of the third cranial nerve. Then it produces contralateral hemiplegia due to the involvement of corticospinal tract in the crus cerebri. It also produces contralateral paralysis of lower part of the face and the tongue due to the involvement of the corticobulbar tract in the crus cerebri. It also produces drooping of the upper lid, that is the ptosis, due to the paralysis of levator palpebrae superioris supplied by the oculomotor nerve. It also produces the pupil dilatation, and it is fixed to the light, and accommodation is lost on the side of the lesion due to the involvement of the parasympathetic component of the oculomotor nerve, the Edinger-Westphal nucleus. Next we'll see about the Benedict's syndrome. It occurs due to the vascular ischemia of the tegmentum of the midbrain involving the medial lemniscus, spinal lemniscus, trigeminal lemniscus, and also the red nucleus, the oculomotor nerve fibers, and the superior cerebellar peduncle. So it is characterized by ipsilateral, lateral squint and ptosis due to the involvement of oculomotor nerve fibers, contralateral loss of pain and temperature sensation due to the involvement of spinal and trigeminal lemnisci, and also contralateral loss of tactile, muscle, joint and vibration sense due to the involvement of medial lemniscus. Then the contralateral tremors and involuntary movement in the limbs due to the involvement of the red nucleus and the fibers of the superior cerebellar peduncle entering into it. Next we'll study about the Parinaud syndrome. The Parinaud syndrome results from a lesion of the superior colliculi as occurs when this area becomes compressed by the tumors of the pineal gland. It is characterized by the loss of upward gaze without affecting the other eye movement. Next we'll study about the Argyll-Robertson pupil. The Argyll-Robertson pupil is a clinical condition in which the light reflex is lost. Here you can see there is no constriction of the pupil when the light is focused on the pupil, but the accommodation reflex is retained. So here you can see for the near vision there is a constriction of the pupil. So accommodation reflex is intact. Generally it occurs because of the lesion in the vicinity of the pretectal nucleus.